So tonight we're joined by Julie Shillabeer, who is a seasoned practitioner with 20 years of experience in traditional Chinese medicine and has successfully treated numerous patients suffering from TMJ and jaw pain. Her expertise, rooted in rigorous training, including a DTCM program and master's training and teacher-level constitutional facial renewal acupuncture, allows her to approach TMJ dysfunction from both a clinical and holistic perspective. She's helped patients achieve lasting relief through a combination of acupuncture, motor point therapy, and sound healing. Beyond Julie's clinical work, she actively engages in discussions on aging, muscle balance, and neuromuscular health with colleagues and international experts. As both a teacher and lifelong learner, she continually refines her techniques, ensuring the best outcomes for her patients. Her personal journey with acupuncture has deepened her empathy and understanding, allowing her to support patients with compassion and precision. I'll let Julie speak, and then I will ask everyone if they have any questions to text, to type it in down below in the Q&A. And after her presentation, I will ask her all of those questions and we can have a bit of a discussion. And I invite you to stay on after the recording because Julie's got some courses coming up. And if you're interested, she'll give you more information about those. But for now, we welcome Julie and we're excited to hear your presentation.
Well, thank you so much, Celine. I have mentioned to her, I started working with Opus Supplies back in 2016 with the West Coast rep Dario, the Italian stallion, and you've always been such a great support for the courses that I have put on. And it's just a beautiful relationship to be able to have support. And, I'm very thankful and honored to be here today and share some of my experiences with acupuncture as a patient, as a practitioner as well, and just talk about something that is such a passion of mine that, we're going to go through what works, what doesn't work, and hopefully you'll get a lot from the talk today. So thank you all for being here as well.
Thank you.
And I'm going to now just share my screen. We're going to be going through my PowerPoint presentation here. There we go. Perfect. Great. So just a little bit of background, as Celine said, I have had lots of extensive research and practice with TMJ dysfunction, facial tension, and facial acupuncture. And my first experience with this was when I was in school in Vancouver, Canada. And I was looking around to see, facial acupuncture, it did interest me. So I found, who had amazing reviews and testimonials, Mary Elizabeth Wakefield, who I'm sure many of you have heard of. I like to think of her as the grandma of facial acupuncture. And so I found a course that she was offering in Berkeley, California. And she was offering both the foundations and advanced courses back to back. So I thought, well, what a great, trip to be able to go on, drive down to California and learn. Especially being a student, we do learn a certain way within Chinese medical school, which is very important. But for continuing education classes, we somewhat branch off of that and learn, within Mary Elizabeth Wakefield's work, Japanese acupuncture, which I think is a beautiful practice in its own right. And, looking at more classical versus traditional Chinese medical modalities. And, when I was there in her class, from the first day, I just knew that facial acupuncture and working with the Shen, the spirit, was going to be a passion of mine. And, every day as I do teach others and work with patients, I am learning more and more and more within this practice. That's just so amazing and beautiful. Now, for myself, talking a little bit about my experience as a patient, I first had acupuncture when I was 12 years old, and it was after a car accident. And I remember when I had treatment from the practitioner, she was very busy. She had ran 4 rooms. And so as, barely a teenager, having these points in me, I remember being left in the room for about 45 minutes and almost had a panic attack because I didn't really understand why these points were in my body. As wonderful practitioner that she was, I felt like there needed to be more time and explanation in what was actually happening with these foreign objects, these needles in my body. So when it comes to my practice, and we'll go through these techniques which I found have worked and how I run it, that have really helped with looking at the multifaceted approach, working with jaw pain, as well as the spirit, the expressive muscles of the face. And, many people feel or think that facial acupuncture is more just a superficial and cosmetic treatment, which it can be. However, what I have been taught through the years is one of a deeper transformation. And we're going to be going through the levels of which we age and grow in this world. And we'll look at then how to balance each of these levels to have a longer standing benefit from treatment. So as we're going through today, I do feel like it's important to kind of just introduce TMJ and jaw pain. I'm going to choose 3 of the main muscles that are involved in the dysfunction of the jaw. Then we're going to look at the Western medical perspective versus the Chinese medical perspective, because there is benefits within both. I also want to look at mouth guards and Botox a little bit, because your patients who are coming in will most likely have had one or the other when they have jaw pain. We're going to do a case study and, looking at those protocols that have really helped me versus ones that have hindered me, and to be able to share that expertise with you today. And of course, any questions that you have on that, I think there'll probably be a few we can talk about after. And we're going to do and look at a few short demo videos along with separate case studies for those, looking at some non-needle approaches, and really introducing sound therapy, which I find for every single patient is a game changer. Another thing that I feel is very important to do with your patients is provide them with home care and check in with them and really work together for how the maintenance of treatment will go. So understanding TMJ and jaw pain, when it comes to the TMJ, of course, we know that this is the hinge-like joint that connects the jawbone to your skull. It lets you open, close, chew, speak, and yawn. It's super important and one of the most complex joints in the body. So the dysfunction of this has common symptoms like jaw pain or tenderness. You might see patients who complain of clicking, popping, or grinding sounds when opening and closing the mouth. They may have difficulty in itself closing the mouth or opening it, or that their jaw locks open or it locks close. So these are all things to just pay attention to, because not all patients who have jaw pain have the same symptoms. They may also notice facial asymmetry and fatigue within the muscles. So why this happens, just some basic common causes are stress and tension held in the muscles, clenching or grinding, which we call bruxism, poor posture. And this one I'm going to pick my phone up for, because most people, you watch them as they look through their phone and they have their head down. And this actually will pull on the muscles, and they may get an imbalance within the bone structure just from looking at, what DMs they have. So that's when you always want to check and see that your patient is actually using their phone at eye level, which it can be difficult to do. So then also there might be dental work that they have, or trauma itself, car accidents, arthritic concerns, degeneration, or overuse of the jaw muscles, people who nail bite or chew a lot of gum. So we know that this isn't just a local concern, but instead it affects the entire system on many levels. And that's really why I think it's important to do this talk today, is to go into those deeper psycho-spiritual imbalances as well. It is linked to the deeper energetic system. So just quickly understanding the jaw mechanics, as we open and then close. We have different muscles that are at the forefront for how this reflects into potential dysfunction. So as we're going to go through a little video as well later, as you palpate the patient's jaw and ask them to open or close, it is important to have that step within treatment to see if there is, as they close their mouth, any deviation from the midline. So you may notice restricted range. Clicking, you might feel into the condyle process, and this can signal as well some more deeper imbalances with the jaw itself. So I wanted to go over just 3 of the main muscles within TMJ dysfunction. When we go through Chinese medical school, we do kind of glance over this. And I think to have a little bit of anatomical understanding of those 3 main muscles I have chosen here that interplay within mastication and TMJ dysfunction. So we're going to go through each separately. So the masseter, this is the primary muscle of mastication and chewing. It's a paired, thick, quadrangular muscle located at the side of the jaw. And we know in Chinese medicine that this is more the stomach meridian. The mandible elevates through the masseter, closing the jaw, and it assists in the grinding movements during chewing. So we may see someone who does grind their teeth, that this is the main muscle we would want to work with. Of course, the temporalis, this is a beautiful fan-shaped muscle on the side of the head, again, involved in chewing, and it works as an interplay along with the masseter and other muscles. The function of the temporalis is to elevate and retract the mandible and closing the jaw. So this muscle plays a crucial role in jaw movements, again, focus more on the closing and retraction of the mandible during biting and chewing. And then we have my favorite, the lateral pterygoid. So this runs deep in the face, running horizontally from the sphenoid bone and lateral pterygoid plate to the TMJ and mandibular neck. This is also fan-shaped and it has 2 distinct heads. There is also the anterior pterygoid muscles, medial pterygoid muscles, but we're not going to be talking about them today. And so just quickly, the different muscles, the masseter closes, the temporalis retracts, and the lateral pterygoids open and slides. So getting into the Western versus TCM medical perspectives to have an understanding as you may be working with dentists or physios through your patient's treatment protocols, you may see them not only just come to you, but other practitioners. So it's good to have an understanding. And so viewing the condition in Western medicine is structural or functional disorder of the joint and muscles. Whereas in TCM, it's an imbalance in the flow of qi and blood, as we know. And then the organ systems focused on the liver, stomach, and kidney. The causes are muscle overuse, again, seeing that clenching or grinding, trauma or arthritis, stress and anxiety, and dental issues themselves. I've been blessed with British teeth, so I've had a few of those in my past. And then in TCM, emotional stress affecting liver qi, that anger, irritability we hold in those areas. It can also be due to kidney deficiency, stomach heat rising, or external wind cold invasion. So for the diagnostics, in Western medicine, we may see a physical exam, which I recommend, palpation, and then they may have some imaging done. For us TCMers, we might look at their tongue and pulse. Palpation is something we'll be going through. I've done a video on that, so we're going to, in detail, go through what you should look for. But then the key is to observe the energetic and meridian imbalances. Focusing on treatment in Western medicine, of course, the goal is to relieve pain, restore function, and manage stress. And I love that manage stress is a part of that, recognizing the deeper emotional level. In TCM, we want to restore harmony, move qi and blood, calm the shen, and strengthen the underlying organ systems as we always would. Now, for the treatment methods, Many of your patients who have jaw pain, they've probably taken some NSAIDs and muscle relaxants. Night guards, as I mentioned, are one we're going to address briefly. Surgery, which is rare, and then Botox, which we will go under as well, and I'll share some stories about my patients. In TCM, of course, acupuncture, and I snuck in there some acutonics, some sound healing, which we have our tuning forks right here. I also have done a video just showing what I find works for the jaw area. And then looking at home care, herbal medicine, diet and lifestyle adjustments, facial, and also auricular acupoints. So coming into one of the most common Western medical treatments that you'll get from your dentist is a mouth guard. So, I find if a patient does have a mouth guard, my recommendation would be for them to wear it 3, maybe 4 nights out of the week. One of the things that can happen is the circular flow from the governing vessel to the conception vessel, they meet here. So it can block that connection. So I recommend to patients to, yes, wear their mouth guard, but alternate either 1 night on, 1 night off, or 3 nights in a row and then 4 nights off. Some of the pros is it can relieve jaw pain and muscle tension. It protects the teeth, which is very important for looking at the receding gum issues. It can reduce clicking, popping, and locking. It's a great non-invasive alternative to surgery. It can improve sleep quality. The cons, it varies with the benefits. I find in my practice, maybe 30% of patients have found great relief from a mouth guard. Sometimes it has caused more tension. So you want to ask your patient, are they using a mouth guard? How often? Sometimes people have one and they have used it maybe once that month. So then you can just cross that off the list of things they're doing. But a lot of them aren't fit properly, so they can worsen symptoms as well. And then the key thing here is it doesn't treat the underlying cause. And as practitioners, that's what we're looking for, is the deeper root reasons behind why this exists. And that's what we're going to go through shortly here. So then we have Botox. Now, it's become, of course, very prevalent within our society. A lot of people watching the video today may have had it, have had experience, their patients have had it. Now, some of the pros are that it can relieve muscle tension in the jaw. It may reduce clenching, and it is a non-surgical option, and it's very fast. So, some patients, they'll say to me, well, I don't want to come in once a week when I can just have one treatment every 3 to 6 months. Sometimes it's every 2 to 4 months. That will save me time, but it's the education that you can provide to really help them understand what can happen. What are the cons of that? What are we not addressing, which is the emotional protection within those muscles. And also you can see things like headaches come up from Botox. And for my main case study, we're going to look at that. Now, because with jaw pain, you may have more than 2 injection sites with Botox. So a patient may have up to 10 on either side as they're addressing the scalp, the temporoparaetalis areas as well. And this is when it can really affect the muscular balance of the face. So if we are having a muscle that is tense and we're injecting it with Botox, we're freezing that muscle, what will then be the interplay on the antagonistic muscle? What I find is you will see that asymmetry of the face, but then you'll also see more sagging tendencies that occur from it. So a lot of patients, they go in, they just want relief. They don't understand all of these different facets of what could happen from all of these different treatments. And, we'll talk about why it's important to, within the initial session, spend that time talking to your patient. For me, this is what works, having an extra 20 to 30 minutes, getting to know the patient so that you can work together and they are then educated on the protocols that you're choosing. This is very important to their benefits, and what you will see with future treatments is they will understand it on a deeper level. And in knowing that, they may receive more benefits with each treatment. And one of the things that I've learned through Mary Elizabeth through the years are the different levels of how we age. And, we talk about, and I'll be talking about the 8 extraordinary channels and how they not only work on the meridian level, but also on the cellular memory level and familial patterns or patterns that an individual has. And if we can cut the cord of those cycles and patterns as an individual moves forward, we may stop the protective nature that they hold within these expressive muscles. So looking at that level, very, very important when it comes to any of the expressive muscles on the face, or, maybe for the traps. If you talk to someone and they're just holding their shoulders up like this, definitely there's some muscular imbalance. And within the initial session, when you're watching a patient talk and express, write some notes down and see what muscles they are expressing, how they are moving their body. And this will guide you into being very individualized for their treatment. We all know that through the Constitution, we might see stagnation of qi and blood with jaw pain, liver qi stagnation, again, holding that tension. There may be a weakness or a blockage of defensive energy. We could also see, especially if it has to do with the jawbone itself, kidney and jing depletion, and spleen qi deficiency dampness. And then we have the involvement of the 8 extraordinary channels. So within this area, we may look at the Chong Mai, as well as then the Dai Mai, the belt vessel, is a very effective one to choose and use. And, looking at then that Wei Qi, how we protect ourselves against the environment, where that's being stored in the muscles, if we can target and eliminate those protections, we're going to open the flow of qi much more throughout the body so that the stagnation has the accessibility to leave. And when we look at the face, these are the expressive muscles, as I mentioned. When we express the person we're conversing with, they micro-mimic that expression. And when it comes to things like Botox, if you do have that within your face and you're trying to relay, I'm very angry at an individual, they're not going to be able to mimic those expressions. So there might be a lack of understanding of the severity of your anger because they can't necessarily connect to it. And, an ancient Chinese axiom states that the Shen leads the Qi. So restrained emotions in the facial meridians limit the exchange of qi to the outside environment. So if we repress our Shen and our emotional expression for a prolonged period of time, this can really detriment the physical structure of the face as well. And again, how we communicate with others. So coming into our case study, so this will be our first case study. And this patient, Lisa, she's about 57 years old, very healthy. She's in competitive sports and always has been. Her physiognomy presented with wood and fire elements. So predominantly yang physiognomy when you look at the face and the hand. And, wood element, they're known as the thinkers. Fire element, they're known as the doers. So she's go, 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 rush, rush, rush. There's not a lot of yin within her body. And that's important to know as well, is within the physiognomy, when we look and discern the diagnosis from the physiognomy level, what they're lacking in also factors in. So she's lacking in water. And so, looking at some of her other constitutional symptoms, she is going through menopause, presenting empty heat symptoms. She also had tinnitus. And just looking at her personal life, she is divorced with 2 children, one of which is handicapped. And that creates a lot of stress and worry in her life. So these things are important to know when you're first talking to a patient. And one of the things that she said is she has a new love interest and it's difficult for her to kiss. So This was an interesting one. Not a lot of patients would mention it, but understanding and her trusting me on a level, which I think is important, is sharing those details with, so you can really then focus on what is important to them. You know, yes, they have jaw pain, but what's happening in their daily life and how that factors into what point protocols we may want to work with. So she had seen her doctor about the jaw symptoms, and he sent her to get Botox. Now, when she had Botox the first time, they just did two injections in the jaw, and it didn't help her. But the side effect was it gave her severe headaches. So when she came to see me, this is something we also had to work with. And the doctor said that, you know, she would need another referral and would most likely get Botox in the scalp, potentially into the back of the head as well, in order to see results, but it may take time for her to, you know, get in to see a doctor for that. Now, originally, this patient saw me 13 years ago, back when I worked at Yinsdale Reproductive Wellness with Dr. Spence Pentland, and I was doing community facial acupuncture there. Now, fast forward to last year, her and a few friends were having dinner one night, and they were all talking about their acupuncturists and how they love the treatment so much. Ironically, they all were patients of mine. And so this lit a fire under her ass. And she decided, you know, it's time for me to come in and have treatment again after all of those years as well. So talking about, you know, when it comes to, sure, I had known her in the past, but this was the present time. And she had gone through so many new experiences in life. She had shifted in life. So her intake form that we had originally done all those years ago needed to be done again. We needed to have and book a longer session. And this is what I was saying, that in general for patients, it is the most effective to book longer for an initial session. And you can charge for that, of course, but having that time is vital. And you not only are going to be talking to them, but you will have time to educate them on what you're doing. And as I said, that's very, very important. Something at 12 I would have wanted. And spending time getting to know them, on their intake form, I have, you know, what are your 3 negative personality traits? What are 3 positive personality traits? And then also, what are a few things you're working on as an individual? So I can get to have that conversation at a deeper level fairly quickly versus just what medications are you on and what treatments have you tried for jaw pain. Talking about the emotions, the expressions, their goals in life, their aspirations. When it comes to how we put our face out in public, this is important. So please, you know, when it comes to the jaw and symptoms around the face, muscular tension, spend that time talking to them. And then again, as you're speaking to them, observe their facial expressions, how they're holding their body, talking about negative personality traits that they might have. Are they comfortable with that? Do they have 20 positive ones and none negative? Maybe they're not in tune with the imbalance, the negative emotions so much within the elements. I know for myself, until I met my husband, my corrugator muscle, I struggled being in tune with it, and I could barely even move that muscle. And now you can see it, it can be quite active. And why? I was around someone who had some anger and irritability, but used those muscles, and I micro mimicked them. And over time, it allowed me to become more in tune. So again, having these conversations on a deeper level, it's very important. So for her, other symptoms that she had, as I mentioned, were headaches. She had corrugator, frontalis, and scalp tension. The emotional weight was on her trapezius, most likely from her handicapped daughter. And so there was this tinnitus that was occurring, and it was high pitched. So we would assume from liver energy stagnation. Now, something I want to share is when I have had patients come in with the predominant symptom being tinnitus, I always ask about their jaw. And a lot of times I find, because of how the nerves run, if we can treat the tense muscles and guide them out the 12 meridians, this actually in turn treats the tinnitus. So make note that if you do have patients who are complaining about jaw pain or are complaining about tinnitus, just ask them, if tinnitus is something that they do suffer from. And, when it comes to Lisa's treatment, and as well with what I find effective in practice for TMJ symptoms, duration between sessions matters. For treatment, what works best for me is one treatment, 1 to 2 times a week, generally just once a week. I find the most detrimental thing is if someone you're recommending they come in 2 to 3 times a week, and every time they go to come in for treatment, they're rushing, they barely make it on time, they're dripping in sweat, and you give them treatment. And, we do have such busy lives that I would much prefer someone to come in and have 5 minutes before treatment to just be in stillness, and then not rush out afterward. Maybe have time for a water or a tea before they leave. I find one treatment like that versus 1 to 3 of rush, rush, rush is much more effective in the long run. So generally, I will say, people have busy lives. Let's just try and do one treatment a week. And, looking at then, once we have tried 2 treatments, I would ask them what percentage of improvement they have. What percentage of improvement locally, as well as just in general, how they're feeling. Do they feel grounded? Do they feel like they need to protect their wei qi and tense? And teaching the patient to look for these signs and symptoms so they also understand what, empowering their health in the duration or frequency they may have, how many sessions they may need is important. So for treatment with Lisa, the improvements were quite quick. And after 9 sessions, we took a 2.5-month break. So after 9 sessions, all the symptoms had gone. And so when she came back 2.5 months later, I asked her, with her symptoms, the tinnitus, jaw pain, difficulty eating, headaches, none of those had come back. But she said the symptom she noticed was the difficulty kissing. And of course, she's going to pay the most attention to this because that was what was important as far as the mobility within this new relationship, which was still going great. And the interesting note, bringing it to the end here with the case study, is she finally got, I believe it was maybe 2 months after we took that break, she finally got the note from her doctor that the Botox she was approved for, and she was going to be able to get multiple more injections. So I asked her, well, how do you feel? Do you still want to do Botox? I'm just curious, And she said, absolutely not. I'm so happy with the fact that we've worked. I feel much more balanced and grounded. There's been so many more constitutional benefits as well. So we will be going through some of those approaches I took with her treatment so that you can learn, a little bit about the multifaceted approach. So looking at their treatment, one of the things that I do want to highlight is home care. We'll be going through a couple of things near the end, but one of the things that works for me is after their first session to email them a list of home care recommendations. So this includes food cures and some healing recipes. It includes, tools that I use that I find really help. One would be a dry body brush and an acupressure mat, things that they can do at home. I do have some YouTube videos. So there's one for Qigong and the 6 healing sounds. And, if they have these home care recommendations, number one, are they doing them? So you always want to check in and say, it's 50% of what we're doing here, what you do at home that really matters. And, are they journaling, giving them little tips to help them be empowered in their health and in their focus of why they've come in for treatment? It's much more valuable. And so, with treatment, you might see, or you may have noticed, I have a little bruise here. And this is something that when you have patients come in, whether you have had any training in facial acupuncture, motor points of the face or not, bruising concerns can happen. And for myself, I explain, well, this is because I was worried and overthinking, and the frontalis muscle holds that emotion. So, of course, through needling, we're releasing the physical blood stagnation, but we're releasing the emotional energy stagnation as well. And so when they understand that bruising isn't necessarily something that's bad, it's a way that we're releasing the stagnation throughout the body. It can move throughout the body in many ways, and sometimes it can bruise. But please make note that using arnica 6C homeopathic pellets are great for people who are bruising more. But it is important to as well spend the time letting them know some of the side effects or emotionally how they might feel after treatment, so they feel safe working with you for a longer duration, and there's nothing that may shock them with how they respond to treatment. So then I also have here, besides a longer initial session and education, intuitive body needling. And so this has to do with listening to the patient's body and Shen, their spirit. And this can be a difficult skill to hone, but it can be very, very powerful because you're listening on an intuitive level to what their body needs, not just what point protocols might be recommended for jaw pain. There's a difference there. And so when I taught just last month in Vancouver, we did actually spend a little bit of time trying this, getting to, learn what is intuitive needling. So number one, when you insert a point, that point will tell you when it's connected with the body. So let's just take one of my lovely purple serums here. And now when we insert the point, again, I always find what works best for sensitivity is to breathe with the patient. Some people may find this silly, but I think it's another way for them to sound out, release stress. So I'll have the patient breathe, I'll breathe with them, put the point in. And then as I go slowly and insert the needle, that needle, the chi, the life force of the body will grab it. I'll pull back slightly. And what I'll find is we don't need to go in any deeper than that, even if we could. There's no point. The connection has been made. That's one aspect of intuitive needling is gentleness with actual needling, whether it be the face or the body. And when it comes to feeling the body's energy, I'd love to just do a little exercise before we move forward. So in Qigong, we know that building Qi is what we want to do. And rubbing the hands together and creating that heat is exactly that. So let's just get that going a little bit more. And now when we talk about Wei Qi, the defensive energy, what is that? How do we feel it? Well, as we bring our hands apart, where does that heat stop? Bringing it back in. This is, of course, that Qigong energy. Right now, this whole area for me is still my energy. It's my defensive energy. And I always like to say when we're working with facial tension, it's a protection of our Wei Qi. So we want to build this and make it strong, because it's those holes that can happen within the Wei Qi that affect those expressive and protective muscles, right? So we don't want someone like this, we want them open. So that's just a little practice. We'll get a little bit more in depth with that shortly. Now, sidetracking, what doesn't work for me? So through the years, I have tried many different combinations of treatments. And one that I found was just way too aggressive and didn't hold is if someone is coming in with jaw pain and let's say a lot of tenderness into the masseter. Well, we all know electric stimulation, and for many different symptoms, it works great. I personally don't feel that it works well for jaw pain. Not only because this is where the spirit, the Shen, shows in the body, but also it just doesn't last. I had one patient, I put a couple in her masseter around stomach 6 and just behind where the tensions or trigger points were, and every time it would just fly out. So, I recommend not doing e-stim on the face. You could look at doing it on distal points, but definitely not a technique that has worked for me. And so looking at then the other thing that doesn't work for me is doing the same treatment over and over again. When we're in school and, here's the diagnosis, here's tongue and pulse, and then here's the point protocol. We know in real life that it's not going to be the same point protocol all the time. And when we work with the 8 extraordinary channels, this shifts and renews our cellular energy. So we aren't the same person that came in last time as we are when we come in again. So you need to then intuitively meet that patient where they are now, not where they were in the past. And this helps the chi continue to move and flow forward. And then finally, the last thing that really I don't find works for me is running 2 rooms at a time. There was a time where I worked on cruise ships, 14-hour days, and I would run 2 or 3 rooms at a time. But when it comes to working with the Shen, when it comes to working on a deeper level of releasing trauma and emotion, what we've pushed down inside, I like to keep my energy solely focused on that one patient. Whether I'm in the room or not, I'm connected to that patient, and that connection doesn't stop until I clear the treatment with the high frequency forks at the end of their session. So I know for many practices, treating 2 patients at a time, monetarily, that makes the most sense. For my growth and development with treatment, it hasn't worked so well for me. I just feel like I'm spread too thin when we're working with the emotions. Now, the next thing I want to do is just go through a little video on the treatment protocol. So we're going to be, when a patient is laying down, we're going to assess by opening and closing the mouth and really feeling where those imbalances are. When they're on the bed, I've found not using a pillow is most effective. So you can assess not only the jaw for opening and closing, going up, feeling the lateral pterygoids, but we can also get behind the neck. When we feel the little knots above the ear, which we'll go into, and then behind, all of these muscles play off of one another. So it's important to get an understanding right away when your patient is, before you put any needles in, is just feeling through those muscles, feeling the fascia, feeling the tensions. Spending the time doing that will help you in practice much more than just getting the needles in right away. So again, spending that time assessing is very important. It gives you the sense of the imbalance of the protagonistic and antagonistic muscles. You can feel I'm feeling for that scalp tension there. I like to check and see what's happening with the cervical spine, the Jaji points, bladder and gallbladder channels as well. As I'm feeling these areas, I may be thinking about, well, what distal points are we wanting to work with? Where are you holding the emotions within your face? And how does that relate to the 8 extraordinary channels? Feeling, of course, the Shaoyang channels, the Taiyang channels. And then I like to finish by doing just behind the ear with the Sanjiao channel. So now we're just going to dive a little bit into motor points before I get into ones that worked for me in practice with jaw pain. So motor points, I'm not sure how many of you have worked with them before on the body or on the face. I think they're very, very special, and they work fantastically in combination with sound therapy, tuning forks, and distal body points. So the motor point is a specific site where the motor nerve enters a muscle, the neuromuscular junction. Needling this area causes the muscle to fire or twitch. So as you're inserting the point, of course, you let the patient know that they may feel a little grab, they may feel some sensations almost radiating from that area elsewhere. And they may find that there's a little bit of heat that comes out, so it might feel hot to them. Now, for each motor point in relation to a muscle, it's located typically in the middle of the muscle, and it's a consistent anatomical location versus trigger points, which are not. So as we say here, comparison with motor points and trigger points, the trigger point can be in varied locations, not specific. Motor points are fixed locations. Now, they can overlap, but they are not the same. Just like motor points can overlap with acupuncture points, but they're not the same because the intention of why you're using it is different. For the needling technique, it does require a slightly deeper insertion. And this is where you'll see in the little video I have next, why we need to go in slowly and fish around a little bit. One side may be lopsided versus the other. They're going to land and lay differently on both sides because we're not symmetrical. So really what happens on a neurological level is the muscle spindle sends messages to the CNS, and this will either relax the muscle. So for jaw pain, we're going to relax those tensions, or to strengthen them if weak. So a note here that if someone has had Botox for a long period of time and the muscles become weak, you can still use that motor point then to help re-strengthen the muscle. So I use motor points all the time, but I use them in combination, and please do if you can, with the 8 extraordinary channels and constitutional acupuncture points. So that as we're lifting up that local qi and blood stagnation, we're then allowing the body to have messages to guide it out. And that's very important as well. So looking at the motor point locations, I'm just going to play this here. So we're going to see the masseter is approximately, again, it varies with the patient, but it's approximately 1 chin anterior to the earlobe. You can see it there. And then coming to the lateral pterygoids, it's anterior to the condyloid process of the mandible. And then the temporalis is about 1 chin above the ear apex. So for acupuncturists, you can see that these land on some of the acupuncture points, but our intention and how we needle it is different. So I now just want to show you a little bit of my needling, so you can take this and use it in practice. And this is Sarah, our lovely model here. So a lot of her tension is in the lateral pterygoids and in the temporalis muscle. Now, when you are needling the face, it's important to use both hands. Don't just come in with the needle and startle them. That's something I find commonly can happen. We want to have love and gentleness as we're inserting these points. And you want to let your patient know that they're going to feel those grabs. They might feel a little bit of a release. These needles will let us know when they're ready to come out as well. If I went to try and take these needles and remove them right now, they would grab and it would be very difficult, definitely would bruise if I tried to pull them out. So you can see here how they're grabbing nicely. And for the actual needles, you know, Opus supplies, they carry Serin needles. I always like to as well educate my patients on needle quality. It matters. It matters how it conducts the energy, and it matters, you know, with the sensitivity. Coming in now, we're going to do both temporalis needling at the same time there, because that can be a sensitive spot, and you're really going to feel the grab there. Sarah, whenever we work with her as a patient, that's the point. She really feels grabs and almost gives a little bit of a headache sensation. So you can also let your patients know that, you may feel a little bit of radiating pain depending on where we're working. So coming into my next case study. So when it comes to sound therapy, it's definitely becoming more popular now. And, we have singing bowls, crystal bowls on YouTube. There's so many different frequencies of music. Now, what I use are acutonics. These are planetary vibrations. And really, with this case study, the patient presented chronic jaw pain, including discomfort while chewing and noticeable clicking when opening the mouth. Now, the individual, they were comfortable with body acupuncture, but they refused to have any needles in the face. So, knowing that tuning forks work on a deeper cellular level to help balance and harmonize the cells, I suggested that maybe we try this as an approach. And so, the facial soundscapes, the tuning forks, a lot of times, simply they help to relax and stimulate the parasympathetic nervous system. So it gets them into a deep state. Now, for every single patient of mine, I ground the patient with the tuning forks all the way down the body. We got the big guns that I use, put them down at kidney ones, because every patient, most of us are in our head. Our chi is all up here. When we needle up here, the chi is going to go even higher. So I think it's really important to ground a patient and allow them to have that connection with their body while we're working the face. Now, when it came to working on the jaw area, you'll see I'll play here what we did. Now I've sped up putting the oil on the face. And the tuning forks that we use are ones that help disperse stagnation. So working with blood stagnation, we use the purple fork, the zodiac fork here. And this is almost, imagine an earthquake and the vibration, how it shifts and moves and disperses. That same feeling is happening through your cells. So we're using that one, and then also the Jupiter tuning fork, and this is going to open and expand. So I find this is very good for the temporalis area, as well as then tensions into the trap and secondary or associated muscles. And with this treatment, I gave this treatment to the patient. It's about 10 times. It did take 10 treatments a week apart. And she was able to open her mouth. She could chew whatever she wanted. And after that, and after I had her trust, we did start to then do a little bit of facial acupuncture, but using a much smaller gauge needle. We tried the 0.20 one chins. We tried the 0.15 16 millimeter. That was okay for her. And we worked from a different protocol, not the motor points, using origin and insertion. But you will find many patients that you see who don't want needling on the face. However, once you spend the time talking to them, getting to know them, getting to know what the treatment will be, that will really, really help their trust in you. And then hopefully we'll have acupuncture afterwards. So then I wanted to bring in a couple of case studies. These are testimonials and patients that have only seen me a few times a year as maintenance. So the first one, Kathleen, this is what she had written. I was referred to Julie by my dentist. And this is who, over time, I hope does refer us more as dentists, because it is such an effective treatment. And it's so rewarding because you're truly helping a patient. When jaw pain, it's a very severe issue, and it's on their faces, affecting them all the time, every time they talk, sleep. So it's at a deeper level emotionally. It can get quite frustrating. And so she had TMJ pain and popping after a dental procedure. She wasn't really sure. She didn't really trust me when it came to having acupuncture. She said, "Sure, Julie, we'll give it a go, but I don't expect much." And she had 5 sessions back in 2018, and it was solved. Now, this testimonial she wrote was 6 months after that. It was in 2019. We had a break of treatment during COVID, but I checked in, asked about home care recommendations. Again, this just gives you more of a personal connection with patients. I always say to my patients, even if I haven't seen you for 2 years, you're still a patient of mine. And please email me anytime, let me know how you're doing and see what we can do for home care. If you're not able to come in at this time, let's figure out what you can do at home. Once I have an update, I can help support them with that. And this individual, she was on the older side. She was about 71 at the time. And still, when she comes in, barely any symptoms, maybe just a little bit of jaw pain if she's had a steak or, chewing something that's quite tough. It doesn't bother her during her sleep at all. So fantastic results. And the next patient, Clarence, so he was a younger individual, office worker, he did web design. And we utilized not only tuning forks and acupuncture, but we did cups as well. And I taught him how to use facial cups at home. And then we also did magnet therapy. So for his treatments, after 2 visits, he felt relief, significant relief. And so he did also have headaches, neck aches, and now he has the tools that we have educated him in for his proper office setup. I'd asked him to send me photos and we worked together to help that when he is working 10 to 12-hour days, he has that support. And what I love about Chinese medicine is there are so many facets and different adjunct therapies that we can add and play with to see what works very well with patients. Another one that I find works very, very well are our little Serin Pionex, our little intradermal needles. And so I'll just show you here, if you aren't familiar with them, they're just little stickers and there's a tiny little Band-Aid there. And so let's say, Pogu was maybe, large intestine 4 was a little tender, but we want to reinforce the point and allow for more stagnation release since it is the command point of the jaw. They can actually keep this on and stimulate it themselves. So again, empowering your patient, knowing that, oh, if I push here, this little needle, it will help continue to relax my jaw. So I wanted to share those two with you as well. And then we have just a little tiny video here for some patients. Again, they may want some gentler treatment. So I've just shown, you what you can recommend them do. I generally would recommend patients do this for their home care versus in clinic. In my experience, everything that they can do at home, they should do at home, not in treatment, because that will, make our sessions longer and cost more. They can't needle themselves and they can't do tuning forks themselves. So come to me for that. Everything else, learn and try and do at home. So you can see how we're bringing that stagnation from the jaw, from the antagonistic muscles, and then we guide it down the traps. And thank you so much for being patient with the talk. We're almost at the end of it. I just want to go through a little active release technique that you can try yourself for the jaw. I do have here a YouTube video to come. So I did a presentation at a gym on intraoral release and facial tension release. So I'm going to be putting that video out very soon as one of the home care videos, so you can look for that. And then I'm just going to skip this forward. Of course, with gua sha, again, these are Christmas presents I give to patients, and you can use any oil, but I like for them to do these things at home. So we're going to come into an active release technique for the jaw. So I've done this 3 times in a row through the video. So I'll just talk through it. So when we're at the cheekbone, we're going to ask the patient to open their mouth. As we bring it down to the mandible, slowly close it. And you can do this as many times as you want. And it helps to relax the lateral pterygoids. It helps to relax the masseter. And that's one that you can recommend to your patients as well. And then finally, home care and maintenance. So I've talked about this quite a bit, and it is something that works in practice. Patients love to have the empowerment and tips, and they're free, for their home care. And this really helps the patient and you as a practitioner band together to rid the jaw pain and all of these symptoms that are popping up, emotional stress, and then them having the tools to do it. So looking at, I just put a couple of the thumbnails here. So we have one for facial exercises. It says the scalp, face, and neck, but we actually go through a release for the front, sides, and back of the neck, an active release technique for the back of the neck. So again, with the jaw, with posture, looking at your phone down, we're going to be pulling on this. It will affect the jaw. These are great to try and practice. And then when we look at what we're doing every single day of our lives and sitting in an office as so many of our patients, I made a top 10 countdown on stress relief toolkit tips. And then as well, acupressure. So there's different acupressure videos that I recommend patients do. So you can see through all of this, checking in with them, spending the time when they first come in to educate them, going through not only with motor points for the jaw and large intestine 4, let's say, we're working and selecting 8 extraordinary channels. I may also do some essential oil spritzing to help with their Shen and calm their Shen. Looking at the 8 extraordinary channels and releasing triggers and cellular patterns they may have, looking at their constitution and how they sleep and how that affects their jaw, finding out where the facial tensions are and other protective muscles of their body and working with motor points to release them, as an alternate using tuning forks to release them, and having intention and love with treatment have all been things through the years that have really worked the best for me, working with any sort of pain in the body and having the empathy for your patients. I think, having gratitude and love for patients is very important. And as a final note, just being able to talk to them as an individual and not think, well, I'm the practitioner, so, I'm up here and the patient's down there. I think it's better to meet at the same level and just be there to educate and support their growth forward as an individual. And with that, I would love to open the floor. I'm going to stop my share here and then Celine, if there's any questions at all.
Thank you, Julie. That was great. I'm glad to hear that a dentist referred. Oh, your
Yeah.
screen is.
Oh, no. Well, it lasted until now. You guys can see my spare room anyway.
It's like the Wizard of Oz behind the curtain.
Teddy bear gets to finally join into the chat. But yes, absolutely. I've gone around through the years and did presentations for dentists through my YouTube channel. I have like secret videos that I'll send them links to that then they can watch and be educated on how acupuncture is just so beneficial for TMJ. And the dentists that I have worked with through the last, I would say 17 years, still refer patients. All of those patients have gone back to their dentist and have been very, very happy with the results. So I actually went in 2019 to the dental conference. It was the year before the dental conference COVID situation. And I went there because I wanted to, spend the time integrating with dentists and dental hygienists and trying to, talk to them a little bit more and educate more on dental pain, TMJ, jaw pain. And so you can look on my website. I have a section that goes over, some of the basics. You're welcome to share and use that as well. Or I'm happy to send pamphlets, if anyone wants to go to their local dentist and talk about how amazing acupuncture is.
Yeah, it's become a hot topic. I feel like not just in the dental world, I think it always was, but also physios and massage therapists really understanding how the jaw is so connecting everything else in the body and how you can really affect change through the
Absolutely.
jaw.
Yes, and let go of those protections. I would say, how many people don't have jaw pain?
Right.
That was the question.
Yeah.
It's something
We
we all.
do have a question. Somebody was wondering if you also prescribe herbal formulas, and if you do, if you found any to be particularly effective for TMJ.
Thank you. Yes. So for myself, for schooling, I did train as a doctor of Chinese medicine. However, I am not licensed to practice herbs. I would love to one day. I kind of went with my education and mentoring under Mary Elizabeth when I had that amazing opportunity to do so, and left the herbs to the side. But absolutely, there's an herbalist here I refer patients to, but that is, again, the individual. It wouldn't be a specific set formula. We would
Right.
have to all of those levels. So just like the individuality with each herb, and how it affects each underlying symptom in the body, I would suggest finding a really good herbalist and then working with them. But no, I don't prescribe them myself.
I also found it really interesting, educating your patients or your clients around their own facial movements, right? So you were talking about relationships with people and how you automatically mimic people, um,
Yeah.
and that slightly starts to move the face in different ways, maybe than your face might move. I thought that was really interesting. You really want to surround yourself with happy people then.
You do, but at the same time, I thank my husband, because people, they all thought I had Botox here because I couldn't move the muscle. And now, you can see we got three there, right? I can at least express and be in touch with that now.
Right.
And to be in touch within all of the emotions for each of the elements is important for the harmony of the system.
Mm.
As long as I'm not doing this all day long,
Yeah.
but being connected with one another. Lillian Bridges, I believe in one of her books, has photos of, of a lady and her dog, and how they start to look like themselves or like each
Yes.
other. And a husband and wife, a photo of when they were 16 as, friends, and then at 68, and how they look similar. And it is that micro mimicry. So Tanya Chartrand was the first individual that kind of talks about how Botox can affect the connection that we do have on that level of understanding one another as we mimic the facial muscles. So it is interesting to know, like, because we all view the face as superficial somehow in our society, and it's just, when I work with patients, I feel at that level we have to work within our cellular memory and traumas and patterns, because we hold it within these expressive muscles. This is how we show ourselves to the world, and
Mhm.
we want to have balance with that. But I would say to everyone, observe your colleagues, observe people you're in meetings with, and are they, I can't really do it, but do you see their jaw like tensing all the time? What kind of tics do they have? It's in those observations where then you can help them more as an individual.
I'm gonna be staring at everyone's face now, waiting in line at the grocery store.
Well, thank you so much, Lynn.
Do we have any other questions for Julia? Let's see here. What's your take on intraoral massage? Do you do
Love
that as
it.
well, or how often? Any tips?
Yes, so there's a lot more RMTs that are doing intraoral massage. I think it is fantastic. As I mentioned, I am just in the works of a video that I'm going to share on how to do it. So that's when you could follow, and we can go through it all. It's scheduled for next week on my itinerary, but I think it's a wonderful thing for patients to do, and get into these areas. Open through tongue tension as well is an area that can reflect the jaw being tense too. So knowing where these facial tensions are, and around our mouths, we're always doing weird funny things. If you watch people's mouths, and we have our selfie mouth, right? Like we're doing very strange things all the time. I can do a little bit of an Elvis lip, but it is important feeling those imbalances and tensions in the mouth. after an intraoral massage, you feel like your cheeks are down here because they're so relaxed.
Have you noticed a shift in your style of treatment as people are on their phones
Mm.
more?
Yeah, I definitely would say the pattern of doing this, we are seeing so much more pulling intention into, the Tai Yang channel, Xiaoyang channel, and a lot more tension into the jaw and forehead here as well. So it's a weird thing to show your patient, okay, I want to see how you look at your phone and then do this. And for most people, they're like, this, I couldn't do this. It's insane, but that's where you want to have your phone is at eye level. Why are we doing this? And we're doing this all day long too. So it is a habit that we hopefully will change. And, this is again where working with a patient and they are a desk worker, having them take a photo of their setup. And, I had one patient, oh, I have my little laptop and I'm looking down the entire time. Again, you're doing that all day long. It's going to really affect the facial tensions and the pattern imbalances within the neck, shoulders, and jaw.
Hmm. Hmm. Are there any other questions? If there's no other questions, I know that you've made mention of some courses coming up and you've got some videos coming up. Maybe we can let people know a little bit about how they can find out what these courses are, or why they want to take them, or some of these videos.